So let's go over the fascial expansion of the foot. Now this is really powerful work because we're going to be dealing with fascial techniques, getting in, stimulating tissue, going to acupuncture points. And why this is so powerful, whether we're dealing with plantar fasciitis, cuboid syndrome, Achilles tendonitis, any other problems, lateral ankle sprains or medial foot problems, dancer's tendinosis, this is great information to integrate into your current practice. So what I want to talk about, first of all, is the fascia of the foot. We have multiple layers of fascia. The dorsal fascia of the foot on the top here, which contains the retinaculum holding tendons in place, affects the entire stability of the foot. And we have fascia of the interossei, areas that are affected in between structures holding bones together. So, and also underneath the bottom of the foot here, the plantar fascia, which is incredibly important because it's part of one kinetic chain. Any kind of tension within the hamstring muscles will go into the calf muscles, gastrocnemius and soleus. The deeper muscles go down to the Achilles tendon, cojoint tendon, and right into the bottom of the foot. So these are incredibly important areas. The thing we're going to do is we're actually going to get into some specific acupuncture points. And why we're going to these acupuncture points is because they're also areas of fascial thickening. So we have increased neurological receptors to the area, which is going to affect the entire foot, the ankle, and even farther up the chain. So we're going to start with stomach 44. Now, stomach 44 acupuncture point is located on the dorsum of the foot, proximal to the web between the second and third metatarsals, at the junction of the red and the white of the skin. So first toe, second toe, third toe, right in between here. Okay, Mickey, how you doing there?
That's okay.
Feeling that point quite a bit?
Yes.
Okay. So we'd get in there and we work the area out for about 30 seconds to even 2 or 3 minutes. If I was doing acupuncture, I would put a needle in here and I would come back and stimulate that point, use the needle back and forth until I felt a tug response where the skin actually grabs onto the needle itself. You okay?
Yep.
So again, this is stomach 44. So the next acupuncture points I actually want to go over is one is liver 2 and liver 3. Now, liver 2 is on the dorsum of the foot, this time between the first and the second toes, proximal to the margin of the web of the junction between the red and white skin. So we're talking right in this area here, very, very close. How you doing there, Mickey?
That's tender.
Pretty tender. And again, you are going to affect multiple structures throughout the body. It's interesting, just by stimulating this point in Chinese medicine, they talk about this actually addressing a lack of energy in the lower extremities. Now, from a Western perspective, you would probably see that certain people who have cold hands and feet. So in traditional Chinese medicine, they were talking about someone's hands or feet that get cold really, really easy, that they have a lack of flow of qi through the area. Doing okay there?
Yeah.
Not as sore as it was?
No.
Good. So just at the border of the white and red area was liver 2. If we move up just slightly from there, we're going to see liver 3. Again, this is on the dorsum of the foot in depression, just distal to the junction of the first and the second metatarsal bone. Okay, how's that feel right there, Mickey? That's pretty tender too?
Yep.
Okay, so you felt liver 2 quite a bit. Are you feeling this as much as the other one?
Not as much as the other one, no.
Okay. And again, we're going to get in there. We're going to rotate the area. We're going to go up and down the groove here. We're going to be there for, 30 seconds to even 2-3 minutes if necessary. And you'll know if it's necessary. If it starts to diminish in intensity quite a bit, then you can usually back off in terms of your timing. How's that feeling now?
Yeah.
Starting to change a bit?
It is.
Okay, good. Okay, the next point we're going to go over is kidney 3. Now, this is located on the medial aspect of the foot, posterior to the medial malleolus, so we're talking here, in the depression between the tip of the medial malleolus and the tendinocalcaneus. So talking about right there. How are we doing there, Mickey?
That is tender.
Really tender?
Oh, holy cow.
So again, we're going to go clockwise, counterclockwise. There we go. Move this around, and then we're going to get right in there and kind of move it. So again, these are thickenings in the fascia or the connective tissue. So any place in the extremities, probably 90% of the acupuncture points in the extremities, you'll find these thickenings. They've done some pretty amazing research on this in the fascial community, basically showing how the acupuncture points have the thickenings and increased neurological input in an area. Doing okay there?
Yeah.
Now, obviously, we're very close to the Achilles tendon here, so this would be quite applicable for that. But also, when we start talking about other problems throughout the entire foot, because we're tapping into the nervous system, we can actually work on multiple areas at the same time. Doing okay there, Mickey?
Yeah.
Pretty sore, though, still?
Yep.
Okay. Get on there. Good. It's kind of interesting in traditional Chinese medicine, too, how even though we're a long ways away from the cervical region, they would also use this point for headaches, for dizziness, blurring of vision. And again, in terms of Western medicine, the only way we could actually relate to that or see that correlation there is if we realize how we're tapping into the nervous system. Again, that is kidney 3. Okay, the last point in this expansion is urinary bladder 60. Now, this is located on the foot behind the external malleolus, so the outside lateral part of the foot. Now, it's in a depression between the tip of the external malleolus and the tendinocalcaneus. So we're talking posterior here, but right here. Good. How are we doing there, Mickey?
That's a good spot.
All right. Now, we're talking about an expansion for the foot here and working our way around there and how it relates to different musculoskeletal conditions. But I think it's really interesting that as we start talking about the neurological connections and how we have an increase in these connections, how it can affect other areas of the body. For example, in traditional Chinese medicine, they would use this point extensively for someone who's experiencing acute lumbar pain. So a pretty powerful area here. How are you doing there, Mickey?
Good.
That's not so bad there?
No, not anymore.
Nothing compared to some of the other points we were working on?
Goodness, no.
Good. So, again, we'd be on here for 30 seconds to about 3 minutes, depending on the response. Now, something to be aware of too, this is not a point you want to be using during pregnancy. But at the same time, the acupuncturist will commonly use this point to help ease a difficult labor. But our focus is totally on musculoskeletal conditions. Excellent. So this is urinary bladder 60.